Welcome to our fourth Resource and Wellness webinar, Stress Management, in collaboration with the American Diabetes Association. Today, our experts will discuss how chronic diseases like diabetes affect mental health. My name is Dr. Daniel Corboy, and I'm the Chief Medical Officer for the Humana Illinois Medicare-Medicaid Alignment Initiative, also known as MMAI for short. MMAI is a health plan program for people who are dually eligible for Medicare and Medicaid. This is a voluntary program that improves healthcare for dually eligible beneficiaries in Illinois and allows them to receive all their healthcare services through one managed care plan. In order to be eligible for the program, a beneficiary must be enrolled in full Medicare and full Medicaid. MMAI is now available statewide in Illinois. This expansion means that all Illinois residents who are eligible to receive Medicare and Medicaid coverage and benefits can enroll in our health plan. As we continue this expansion statewide, we strive to be present in the community to break down barriers in communication between members, community groups, provider groups, and managed care organizations. Our goal is to decrease confusion and provide services in order to best serve our new members. I hope you enjoyed today's presentation.
Hello, everyone, and welcome to the 335th day of the year. I am so excited to be here and moderating with these two experts. So again, let's kick it off. I just want to introduce you to these two lovely ladies that you see on the screen. First, Candace Fleischman. She's a training and supervising analyst of the Chicago Psychoanalytic Institute, as well as in private practice in Highland Park for over 20 years. She sees adults for both psychoanalysis and psychotherapy, as well as psychodynamically informed supportive psychotherapy to families when a child is diagnosed with type 1. Formerly Associate Dean and Chair of the Faculty Appointment Committee, she currently teaches in the Psychoanalytic Education Program. And last but not least, Tina Drosos is a pediatric health psychologist at the University of Chicago for the past 15 years in the specialty outpatient clinics, as well as on the inpatient side as part of the Child and Adolescent Consult and Liaison Service. She directs the Health and Wellness Program at the Kovler Diabetes Center, where I am, and she and her staff conduct psychological evaluations and brief interventions using cognitive behavioral therapy. Ladies, thank you so very much for being here today. I'm going to kick off just kind of start with some questions here, and I'm going to turf it back off to you. How does diabetes affect people's lives at different life stages? And how do they react at, diagnosis versus 10 years down the road? And so again, can you explain that for us a little bit? Tina, did you want to get started with that?
Sure. I can talk, I'll talk a little bit more about the pediatric side, and then Candace, I'll have you talk a little bit more about the adult side. How about that? I'm glad we're starting off with this question, because I think the idea of understanding diseases, especially a disease like diabetes, from a developmental standpoint is extremely important. And what that means is based on when, and not necessarily even how old you are, although most of the time your chronological age does align with your developmental age, sometimes it does not. So really being mindful of developmentally, where is this individual at the time of diagnosis? So if a child is diagnosed very early, infancy, toddlerhood, early childhood, sometimes, of course, there's a lot of stress that's felt with that particular child in terms of getting them to take a shot. The sight of the needle is sometimes very scary, but a lot of that stress is really on the parents. And that's a lot of what we talk about when we have kids who are being diagnosed at a very, very young age, infancy, toddlerhood. And although the initial diagnosis, of course, is hard for everyone, when you're that young, you sort of grow up with the disease. And the impact of the disease, that initial diagnosis, is not felt as much or as difficultly or as traumatic sometimes as it can be felt when you're a little bit older. So if we move on to mid-childhood, early adolescence, that is a really difficult time developmentally for kids in general to navigate. So you're sort of navigating, you're in a time where you're doing a lot of self-exploration. You're trying to be more independent. You want to be out of the house more. You want to be with your friends. Maybe you just got a driver's license. And now you have this diagnosis that really impacts a lot of those developmentally normal lines of trajectory that you have. So I'm 16, I just got my license, I should be driving. I got this diagnosis, now everybody's saying I can't drive because my blood sugar might dip. So what's going on? So, and you didn't grow up with the disease. So you had a quote unquote normal disease-free life. And then one fine morning, your entire world gets turned upside down. So when you are developmentally in that middle childhood, adolescence, that can be an extremely difficult time. The other difficult time, because we know, diabetes can be diagnosed at all different ages, that young adulthood age, that's another very critical time developmentally. If you're thinking about young adults, typically they're moving out, they're heading off to college. Even if they're not moving out or heading off to college, ideally they are a lot more independent. They're trying to work, they're trying to save money to begin their life and sort of get out and do things on their own. And again, all of a sudden you get this diagnosis that sort of puts the brakes on that normal developmental trajectory. And that can be extremely stressful for all the reasons we were just talking about. Like you have this view of what you thought your life would be in the next year, 2, 3, and now you might have to put the brakes on that to take care of the diabetes first. So that can be a very difficult time. So I guess I can maybe stop there, Candace, and hand off the baton to you to talk a little bit about what it's like maybe in adults.
Well, I'd rather go back and talk about it because when I work with families, it's a child who's been diagnosed mostly, although I have followed some of these kids. And I know the children of my friends from JDRF when it started way back 40 years ago in Chicago. So, but I do want to show a little difference in our approaches to the therapeutic work that's done in the city. Because I would say somewhat behaviorally, I would agree that the children can adapt, use the skills they've developed at different ages. But the long-term effects are sometimes actually so difficult at an unconscious level for the little ones who are diagnosed. I know many of you probably who are viewing today understand the idea of the first 5 years of life and the idea that children, little boys fall in love with their mommy and little girls fall in love with their daddy. And then this crisis happens and it can be taken internally as with great significance that will only unfold as one grows up to see that kind of an effect. So yes, I do agree. The children, when they're little, learn, well, this is just life as I know it now. But nonetheless, a 3-year-old, a 5-year-old come home with questions like, am I going to die now? One little boy, grandpa had died the year before. And at the age of 3, he'd been told, well, the doctors did what they could, but grandpa died. And so this idea that they can't fix this now for me was terribly scary. Or the 8-year-old who came into my office and got nose to nose with me and said, I'm fragile, you know. And of course, my response was, I know you think you are, but you're not. And so these little children have very strong reactions. Fortunately, let's take the positive. Many families are listening for this. Moms and dads are sensitive to it and can respond to it. Without that, children develop their fantasy, their story of what this is all about and why it happened. That's going to come out much later in life, but we don't see it necessarily when they're little. Birth order is important at diagnosis within the family structure. If it's the little one that's diagnosed, it's a little bit easier than when it's the older one that's diagnosed, actually, because that's the one that's babied and tended to and taken care of. So it fits in with the structure a little bit more. I want to speak just for a second too about the parents when child's diagnosed, because those who can hug together and cry together and deal with it together are going to have a stronger marriage, and it will help that child feel held and secure than when the parents spar or blame or are so they in their upset come apart. I could say more about this, but maybe we should get on to another question. In terms of adults, though, you know, they come in and see me then as adults later, and we work on issues that intersect with the diabetes, but aren't usually only about the diabetes.
No, very good point, Candace. Thank you, ladies. No, that's a great kind of setting the stage, because again, it affects the entire lifespan, you know, and you're going to have different issues along the way. So, you know, again, with that in mind, you know, I think you've touched on how diabetes can impact, you know, their lives, but also I'm interested in, you know, how diabetes affects mental health, but also how the pandemic, you know, how you've seen the pandemic affect mental health with chronic conditions. If you wouldn't mind kind of elaborating on that a little bit, and also kind of some of your approaches, you know, to kind of that stress and coping, I think are really the most important components as well.
You want to start, Tina?
I'm happy. I don't want to start all the time. I want to make sure we take turns, but I can start this one for sure. So, you know, as everything else, the pandemic has affected definitely the lives of people with diabetes, like it's affected all of our lives. But I think those with chronic illness have really felt some of the really main problems that the pandemic has caused. So number one, what this pandemic, in my opinion, it has really been a problem is this lack of control and uncertainty. So there's a lot of lack of control in our lives. There's a lot of uncertainties in our life, but with a pandemic, when a pandemic like this hits, it's like the reality of no control, no certainty. I don't know what's happening tomorrow in this kind of pandemic, and where I'm going to be, and my loved ones and everybody else. So when we have a sense of loss of control, a sense of increased uncertainty in our lives, that tends to increase our anxiety, our fears, our nervousness. And what I have found is a lot of individuals have been complaining, or at least, you know, wondering about this increase in anxiety that they feel. And I think that the pandemic has caused that. So those with diabetes, that's doublefold, because your anxiety increases, right? So when your anxiety increases, sometimes that's followed by a lower mood, maybe not necessarily a depressed mood, but kind of struggles with your mood. And that can make it a lot harder to follow the diabetes regimen as closely as one should be following, and as consistently as one should be following, which we all know following a diabetes regimen is extremely difficult work. So when your mood is low, when you're anxious, that doesn't help that. Secondly, isolation. Obviously, one of the main ideas that were communicated to us was isolation. They didn't use the word, we use social distancing. However, what social distancing really translates to is isolation. Not really, but that I think is how people have felt. And people with chronic illnesses, people with diabetes, they sometimes rely on support groups, support networks, to kind of feel like, okay, there's other people in this world that really understand how I'm feeling. And now we lost touch with those. There were things online, of course, that people could do, and Zoom events and all of that, but it became a lot harder to do that. So I think that became more difficult. Additionally, what we also know about somebody who's struggling with increased anxiety and perhaps increases in mood is that sometimes that in and of itself can affect your blood sugars, especially for somebody with diabetes. And so we had a lot of patients coming in saying, I'm doing all the same things and I can't get my blood sugar under control. Well, that's because your stress level is up and your blood sugar is doing this all day long because it's sort of mimicking what your stress is doing all day long. That's really hard for people. So I think those are some ways that, in my opinion, the pandemic has affected everyone, but especially people with diabetes.
I'd agree with absolutely every bit of that one. And I can only add, I think there was some fear sometimes regarding resources, literally fear of that you would be able to get your insulin, get your syringes, be able to take care of yourself, which was a horrible existential fear. And then also the pandemic, I'm afraid, added more substance use for adults, young adults, older adults, that complicated the situation, of course.
Oh, definitely. No, I agree. We've been seeing that, throughout the entire, having that conversation of, especially even with children and teens. I can't condone it, but we need to really have this conversation about healthfulness. And again, we're seeing so much more of that. So
I think the resources, Candace, I'm so glad you brought that up, because that was, I think there was even in some places some shortages of insulin and things like that. And so that's very scary.
Absolutely. What do both of you think about, how do you, when you're talking to someone, or even just some recommendations for coping, and, and how do they minimize that anxiety? And then kind of on top of that, when should someone be thinking about seeing a mental health professional? I think we have to normalize this, because a lot of people always consider, oh my gosh, you're sending me to this person, you think there's something wrong with me. No, it's absolutely normal. It should be, something that everyone with diabetes sees a mental health professional. That's just my opinion. And that's how we really roll at the University of Chicago as well. But I'd love to hear your opinions of, giving the folks that are on today some, coping, mechanisms, but also giving them your perspectives of when they see a mental health professional, and then how each of you kind of approach that, because I know you have two different approaches. Yeah, so take it away.
All right, I'll do it first. Well, that's about that. I hear 3 or 4 different questions there. I'll start with the first thing I'd like to start with is how we approach the tasks of self-care and how it influences anxiety. So person with diabetes checks their blood, they see a number. That's not their score as a diabetic. It's only a number to say what to do next. If I could emphasize that above all the rest of it, that would be the most important. And then how to avoid major stressors. Well, I'll go back to what Tina said about feeling control. I think that when one can feel control about some of the details, it's going to help reduce some of the stress. So making last minute decisions or needing to rush are things that create anxiety in most folks. And I know for health reasons, my husband and I are on a plant-based whole foods diet, and we've got homemade lentil soup in the freezer in individual portions. We've got black bean soup in the freezer. We don't wait that day at 5 o'clock to say what's going to happen for dinner tonight. Also to keep sugar absolutely everywhere, glucose source for people with diabetes. It should be in the car, it should be in your pocket, it should be every place you're going to be ahead of time so that it's not a stressor. There's a great book out now that addresses type 2 diabetes. I know we have some of our audience, I guess, is about that as well. And that's Dean Ornish's new book, Undo It, which you could probably get at the library, which is wonderful. He speaks to the 4 components to controlling stress, and he speaks about diet, he speaks about exercise, he speaks about stress reduction with meditation, and he speaks about love, which is the connection. And I think we ought to talk about that as well. Who you want to be around and who you don't want to be around. But I'll leave that for a separate question, maybe, because there's so much we're piling onto this one. Tina?
Okay, yeah. So again, I agree with all of that. I mean, like Candace said, she plans, she and her husband have their lentil soup. So that's structure, routine. that's control. That's one way to really try to gain control, is have your days be structured and have a routine available. The less uncertainty there is in your day, the less stress and anxiety you likely will feel. So make sure you structure and you plan your days accordingly. Another really important thing for managing stress is sleep hygiene. So, and make sure that you're getting good sleep. You're going to bed at a reasonable time. You're able to sleep through the night. You're able to wake up feeling restful. You're not having restless sleep. If you are struggling with sleep, you should probably talk to your primary care doctor to see what's going on with that. And could there be anything that could be done to help with sleep hygiene, because getting good rest is going to be really important. Seeking social support can help with anxiety. So, you know, Candace mentioned love, surrounding yourself with the people you want to be surrounded with. Sometimes we don't have choices. And so we sometimes have to be surrounded by individuals who increase our stress. If that is the case, also, you know, split your time, find a support group, or find a supportive friend, or find a supportive family member, find that one person or two people that definitely will help increase your feelings of, you know, belonging and social support and peer interaction and things like that. And other ways to decrease stress, Candace mentioned meditation, relaxation strategies, distraction strategies, breathing strategies. These are so easily found online. You can download apps, they're free of charge. You can do you can practice mindfulness, you can practice relaxation strategies. Set aside the time, put it in your daily routine, set aside that time to be able to do that. Now, I imagine that some of you are saying, lady, that's a lot of stuff for me to do in one day. I don't even have time to get to everything I need to get done. These are all extras. Yes, but if you structure your day like this and add these coping strategies and skills in your day, it will probably make you actually more efficient in all the other things you're wanting to get done that day, because your anxiety and your stress will be under control, and those things will not distract you. Find ways, I would say where I want to leave this question is, find what works for you. And that message is really important. What works for Candace doesn't work for Amy. What works for Amy may not work for me. And that's okay. And sort of practicing that with your significant other, with your family members, that, you know, you go on a run to relieve your stress. I eat my chocolate to relieve my stress. It's okay. Chocolate's probably not the best thing, but the point is, be mindful of the fact that everybody copes differently to manage stress, and be accepting of all the different strategies and find what works for you and practice that.
Amy, can I tag on after something to that? Okay. You know, Fred Rogers said, if it's mentionable, it's manageable. And to me, that means you need to find the people you can really talk with. Not just the Pollyannas, but the people who can listen when you're angry, when you're sad, when you're frightened. The people, as Maya Angelou said, and I'm going to paraphrase her, it's not what people do for you that counts, it's how they make you feel when you're with them.
Well said. No, thank you.
I didn't even see the chat about being open-minded, but there you go.
And I was kind of multitasking while I was listening to
you.
But no,
I can't do both at once, lady.
And you're right, Candace. I did pile on a lot onto that previous question. I appreciate you bringing me back down to earth here. And so, you know, again, certainly, you know, you both did such a great job of focusing on kind of how people can cope. And so I wanted to ask a follow-up question to that. And so, because again, Tina, you gave some great examples. If someone said, like you said, lady, there's a lot going on, you know, I'm not going to be able to do all this. What kind of strategy do each of you can just say, you know, just one thing to start? Again, what might you suggest just to the audience today, just to say, we know that it's the holidays, and happy Hanukkah to those of you that are, and have Merry Christmas for those, in the future, and Kwanzaa and everything else that I'm forgetting. But, again, what can you, kind of recommend to those folks of just one thing that they can work on? I know, and that's a loaded question, and that's going to get to my follow-up question after that.
I can go, Candace, if you want. So I don't know that I have a to-do, but I guess if it was one thing that I would say to people is be accepting of how you feel and be okay with not being okay in this moment. So that would be my message. Accept how you feel. It's valid. It's your own personal experience, and be okay with that. We'll work on that. That maybe gets to your next question, but that would be my one thing to say, like, be okay with how you feel.
Yeah, what Tina says is spot on. And although when I work with someone, maybe it just come in from a window instead of the door with, they're going to bring that out. Behavioral treatment, as I understand it, and I don't know that much about it, but Tina can correct me, is a more conversational, directive sort of approach. And a psychodynamic therapy is a more of all human beings have certain needs and instincts and wishes and desires, but it's in the individual situation. We have to find out the part that's not known consciously when the person enters into treatment. So when we say it's unconscious, you can't be held responsible for why you don't get up and do something positive in the morning, because when you start treatment, you have no idea what that is that's stopping you. Those are the defenses and the resistances that the therapist and the patient are both working together against.
Thank you, Candace. And so knowing that, of course, Tina, when we think of when, as you said, again, here's one thing to work on. When should someone say, all right, it's time to see a mental health professional, and how do I go about doing that? But also, who should I be looking for?
Yeah, so again, like Candace said, I come more from a cognitive behavioral hat. And so I think this is great because Candace and I can offer some different perspectives on how to be thinking about these issues, and how to look, not necessarily how, but who, and which perspective fits better with the kind of person that you think you are, and what method you think would work better for you. But to sort of answer that one question, which is, when do I seek help, I think is what you're asking. So I always tell people, when these symptoms that you feel like you're experiencing are interfering with your daily activities, are interfering with your ability to do what you want to do every day, then that might be time to talk to somebody. Sometimes, as Candace said, it is all in the unconscious, and maybe we don't have great insight into, I wanted, that this is getting in the way. Listen to your loved ones. Sometimes our loved ones or our friends, those individuals will tell you, hey, I've been noticing this. Why are you doing this? Why are you acting like this? Pause again and say, okay, this is different from my typical self. And I always tell people, you know yourself best. So I could be a therapist. I'm never going to know you the way you know you. So be mindful, stop and take a pause and think to yourself, is this me? Or am I struggling right now? And do I need some help? But the main thing I tell people is, when these symptoms start to interfere with your life, then it's time to seek some help.
Yeah, I will just emphasize on top of that, earlier rather than later. Any changes that feel out of sorts with sleeping, eating, increased sadness, lethargy, trouble with relationships, just wanting to figure stuff out, just needing somebody who's been, studying what's going on a little bit to join with you against these troubles. And as I say to friends, family, whoever talks to me about starting treatment, you can always quit. Give it a try.
Well said. And I know, Candace, you did already give a little bit of an explanation of your approach, but I would love to, because again, you both have such they're great different approaches. So, again, just to kind of explain that a little bit, because I know I alluded to cognitive behavioral therapy when I introduced you, Tina. So, again, if we can, at least just kind of talk a little bit about what that might look like if someone saw someone for CBT versus psychoanalysis.
Who did you want to start with that, Amy? I start with that? Okay. So, I noticed certain personality types are drawn, I think, to different kinds of therapy. When I had my office downtown, the undergrads from the University of Chicago who would come to see me would often start with, I just need some tools. I just need some tools for this. And I'd say, well, the shed's back out in my house in the suburbs. I don't have any tools for you right now, but let's just talk a little bit and see what's going on here. And once they relaxed, we could get going with the kind of work that I've been trained to do. And what we think about in psychodynamic therapy or psychoanalysis is that our human mind and feelings are layered, and things that have influenced us throughout our life are going to be affecting us in different ways as we go along. A symptom is a failed compromise that a person demonstrates to themselves to try to deal with very uncomfortable feelings and getting along in the world. So when someone develops a phobia or symptoms of anxiety, or, the litany of things that people go into treatment to talk about, we think of it that way, that we're trying to cope, but there's something that's the unthought known, we refer to it as the unthought known. You know it in your system, your body, your heart, you're anxious, you're sad, whatever it is, but you don't know it. And people come in oftentimes feeling responsible as if they're going to school. I need to tell the therapist something to get approval that I understand this, and it's not expected. You come in and just start talking. And one of the beginning parts that helps people so much is just hearing what comes out of their own mouth. If they don't censor it, plan it, and they're not answering questions, they just start to speak and begin there. So I know that's a very superficial answer about psychoanalysis or psychodynamic therapy. But in our time constraint today, I probably shouldn't give a whole lecture.
No, but that's so helpful though, Candace, because again, we want to make sure that the audience understands, what are the differences? So Tina, fill us in on cognitive behavioral therapy.
Yeah, so these are all different psychotherapeutic modality interventions. Psychoanalysis is one of them, psychodynamic psychotherapy, and then cognitive behavior therapy is a different one. And I think before I describe it, I just want to make sure that the audience understands, there's no right or wrong. Sometimes there's a better fit, like Candace said, with your own personality and just kind of how you approach problems, how you problem solve, what your personality is like, and that relationship with the therapist is really important. But there aren't typically no right or wrong treatment. So it's not like somebody can say, I should do psychoanalysis because of this, or I should do cognitive behavior therapy because of that. So make sure people understand, it's your choice of which modality you want to do. And like Candace said, you can try it and you can stop it. Typically no harm done from talk therapy. So you can try and see what works for you. So cognitive behavior therapy is a lot more conscious, I guess I would start with that. So the premise of cognitive behavior therapy is that your thoughts affect your feelings and in turn affect your behaviors. And where we intervene in cognitive behavior therapy is those thoughts. So any dysfunctional thought, we call it, any automatic thought, we intervene at that thought level, change the thought to make it more positive, adaptive, functional, because what that will eventually do is then change your feelings, which would change your behavior. So I'll give a very, very simple example, and then I'll stop there because like Candace said, I don't think we can go into like a whole explanation, but I wake up in the morning and I'm about to go to my college class. And my thought is, I can't ever talk to anybody. Nobody likes me. I'm such a loser. That's my thought at 6:30 a.m. So my feeling as a result of that thought is, I'm so sad. I'm so anxious about going to class today and talking to people and seeing people. So what happens if I think I'm a loser and I feel really sad and anxious about talking to people? I'm going to get to campus and I'm going to avoid everybody because I'm a loser and I'm anxious to talk to people. So I'm going to come back home, and I was right. Nobody talked to me. I didn't talk to anybody. So nobody likes me. I mean, that's so simplistic. So where we would intervene is in that thought. So I wake up in the morning, I have the thought, I can't talk, nobody's going to talk to me. I can't talk to any people today. Stop. Let's process that thought. Is there evidence to support that thought? What is your evidence that you don't talk to people? Let's talk about yesterday. You said you were at some lunch gathering with your book club group. Oh yeah, but that's, oh, okay. So you get then the patient or the individual to sort of find those strategies to change that thought. So yeah, you know what? I do talk to people sometimes. I'm going to go there. I'm going to go to my class today and I'm going to say hi to somebody. I feel better about myself. I feel happier. I feel less anxious. I get to class. I say hi to somebody. Somebody says hi to me back. I come home. You know what? I can't talk to people. I'll do that again tomorrow. Again, very simplistic, but that's how, on a simple level, how cognitive behavior therapy works.
No, thank you so much, because it's just helpful just so people understand that there is no one approach. And, again, it does need to be individualized. So those are great. Thank you so much. Yes, Candace, go right ahead.
I should probably differentiate a little bit by suggesting what the difference in thought about the two from the psychodynamic side is. If we don't understand why the person felt like a loser to begin with, what fueled that there will be a new symptom some months down the road then that's going to express that unconscious piece. So that we can, sometimes I have found that people can use DBT and then come into psychodynamic therapy later.
No, mixing and matching and finding what's going to work for you. I think that's great. And I know this is a loaded question, and I don't expect either of you to go into too much detail, but again, is a session enough? I know the answer to this, but I just wanted people to understand, again, the process before we move on to another question.
No. Candace, is one session enough for psychoanalysis?
What we find is when people start treatment, oftentimes they'll say things like, it's so self-indulgent to take care of my feelings. Oh, I feel like there's other people have worse problems than I have. But your problem's your problem. Your feelings are your feelings. They're important. And so there's a resistance at the beginning for many people, unless they're in terrible pain, in which case they come in with, please, do you have anything that you can help me with? Let's start right away as fast as possible. But usually there's more ambivalence, and then treatment starts kind of slowly, it builds up. And then in the middle of the real work that's helping someone, it's a feeling of such engagement, but a therapeutic alliance, that there's work to be done, things to be understood. Somebody gets it. Somebody knows me. They understand. And then when the unconscious is made conscious and you can look at it and you can make the changes at that level, it begins to feel like, I got other things I want to do with my time. I don't think I want to spend my money this way anymore. And then you sort of go down the hill on the other side with, I think I got what I came from. This is good. So that's the good ideal trajectory of a good treatment.
So I also think, Candace, correct me if I'm wrong, but a difference in sort of cognitive behavior therapy versus psychoanalysis, we do view cognitive behavior therapy as a little bit more like time limited. Mm-hmm. We have some manualized protocols that we use for depression, for anxiety, and those are about 16 to 20 sessions. It's definitely not one, but you can get through a cognitive behavior therapy protocol theoretically in around 16 to 20 sessions. And so it is viewed as a little bit more time limited. Mm-hmm. And I think Candace's point earlier about, you can try CBT, sort of get the tools, because we do talk about strategies and tools. Mm-hmm. And then if that didn't work for you, not that you should try CBT first and then psychoanalysis, but sometimes CBT can work a little faster, because it's like, okay, here, try this. And so you can try CBT because it is more time limited, and then you can go to psychoanalysis or vice versa, whatever. But the point is, it's not one session. There's definitely more than one session, but CBT is supposed to be a time limited intervention.
Let me just clarify, if I may. What I'm referencing today is not psychoanalysis. I'm referencing psychoanalytically informed psychotherapy, psychodynamic psychotherapy, or even psychodynamic supportive psychotherapy sometimes. And also I want to put in a little pitch for, there are group methods that have helped people tremendously with like AA, for example.
No, and actually you read my mind, Candace, because that's kind of my next little question for both of you is, again, of course, the holidays are upon us. So I know this is a two-part question, but, the first is, how do those with diabetes, how do they, what kind of coping mechanisms can they use to, I don't want to say get through the holidays, because again, it's supposed to be a joyous time, but, again, I know a lot of people think that way, but, to enjoy the holidays, but also kind of that stress management, but then also, what support options could be beneficial for these folks as well. So I know two-parter, but we can do, one at a time if you'd like.
Yeah, I think that'll be something that Tina can take over much more than I can. I would just say that in terms of coping in the moment, to know that there is help there if it turns out that that's what you want and that you'll be able to get it. You can reach out to your PCP, you can ask your endocrinologist for a referral, you can go to I think the ADA has a list, JDRF has a list, the Chicago Institute of Psychoanalysis has a clinic with a sliding scale fee. There are community mental health centers. There was a lovely article in the New York Times about a week ago, and it was, "Your mother is going to aggravate you." so there's plenty out there also in the media that's going to help people know that there's others out there dealing with the same stressors over the holidays.
Yeah, so I would say if you're looking for more specific strategies for how to get through the holidays, again, I don't like using that, but it's similar. I think we can use similar strategies that I sort of discussed at the beginning. At least what I'm telling folks is set your boundaries. That's going to be really important. What do you want to do? What do you not want to do? And not in a narcissistic way or like in a selfish way, but what can you do? What can you handle this holiday season or this week or tonight based on how you're feeling, and what can you not handle? And again, that idea of it's okay to not be able to handle something tonight, like a major gathering with all my extended cousins. No. I came home and I want to spend it with my immediate family. I don't want to go to this big party. That should be okay. So knowing what you can handle, can't handle, want to handle, don't want to handle is important, and setting those boundaries for yourself and your family. Again, structure, routine, predictability, all of those things are also really continue to be really important, especially during hectic times like holiday seasons. Planning is great if you can, like if you're going to travel and you're going home and you've got, why didn't you come visit me? What about me? What about me? And then you've got all of a sudden you have 10 people to see in 3 days, and that's really hard. So prioritizing what you can handle, what you can't handle, making plans ahead of time so that everybody is aware, and then going with that. And then practicing your self-care, your relaxation, your meditation, all of that should also be happening during the holiday season, especially because it's a very hectic time.
Yeah. What would you say, ladies, to the audience that, I'm just thinking of myself as well, that, I'm going to have now events like 2 and 3 times a week now until the end of the year, and I know I'm going to slip up. I know I'm going to have something that I, don't want, that I shouldn't be drinking or I shouldn't be eating, and I might not be sleeping as well. And, that's going to kind of pile on me. What would you say to someone, with diabetes that, again, we have all of these temptations that are going to be, laid out in front of us, and what do we do?
Well, if it were appropriate to the particular person I was working with, I might speak to their superego, we call it, the part of ourselves that's our conscience, the part of ourselves that tells us when we're guilty or innocent, the part of ourselves that tells us what's our best self, and are we meeting that expectation or not. So it would be done at that level. It would be about who we are and what we expect of ourselves, and finding out the roots of when the superego is too harsh, when our self-judgment is more than it ought to be.
We're talking about forgiveness, right? Forgiving ourselves a little bit.
Or accepting, a diabetic might want to have a couple of drinks and might want to eat a certain kinds of foods and do all the things. And personally, that's okay. Of course, watch the numbers, watch your sugar, bolus for it, all of those things that at least the luxury of modern medicine allows us to do. As Candace said, don't let your super ego be too harsh.
No, thank you. Now, and Kayla from the ADA, thank you for this question, asked both of you, how do you personally deal with stress during the holidays?
We're going to talk about ourselves. So I'm a planner, and I think maybe it's why I talk about it so much. I do try to structure the holiday season and kind of know which days I'm doing what and with which people. And if it's too harsh, I'm sorry. But once that fills up and people start asking about other things, I say, I'm sorry, I can't do it. We'll do something in January. But I used to try to fit everybody in everywhere. And then that would increase my stress level. I wouldn't sleep well. I would eat too much. And so I have sort of taken a little bit of my own advice and not doing those things. I try to set limits, again, in those ways. I do try to practice some self-care. I try to increase my exercise so that I get that the exercise going also during the holiday season, also to really help with whatever I'm going to be eating, but also to help with relaxation and stress and to burn off my calories. But I do that. I take some time off work in a way that I didn't used to. And I think that that's really helpful to kind of allow, I work at the University of Chicago. It's hospital-based. Hospitals don't close during the holidays. So, it's not, we don't get the time off because it's the holiday season. So, but I do take days now and just sort of learn to sort of be okay with that, be okay that I need some time around the holiday season to spend with my own family. And again, practice that idea of doing what makes me happy and what I want to do without feeling selfish about doing it.
So what would I say about this? Well, in our training to become psychoanalysts and training analysts and supervising analysts, as I am, we are well analyzed as part of part of the process. So I know my unconscious pretty well. I know what I need and what's getting stirred up when it gets stirred up to address it at that level. And I do also, as Tina does, I try to stick with my usual routine. You know, I have to add, it's the time of year when I'm happiest to be Jewish, because I watch Christmas go on and I think, oh, I'm so glad. Because it seems so hectic and so full of festivity and could be really lovely. And you know, I love Christmas trees and all of that goes with it. But I can always sort of enjoy that others are doing that and including me when I want to be included. And our holiday of Hanukkah is a much smaller holiday. So the season is a little bit different for us. Now, I want to add too, the last 2 years, I went nowhere and did nothing. So, you know, I think people should be thinking about slowly re-entering, because what I'm hearing from folks is they go to things and they get very anxious. There were no masks, there were too many people. And so I would say not only to pick in terms of as we would have picked 3 years ago, but now there's that added layer. Think ahead. Am I going to come home feeling miserable that I participated in this?
No, good, very good point. Ladies, we have a question. And so I know this is a long time listener. So again, I wanted to make sure that we, that we address her. What can people living with diabetes do to feel more in control of diabetes and the stress that comes with it?
You want to go, Candace?
Well, again, you know, because it's the point of view from which I work, the more you know your own self, the more you know the feelings and can look at them and understand them, of course, I think the better off you're going to be. And then all these other pieces that we've been referencing about control, about organization, that are going to make it simpler day by day to feel calmer. To be angry sometimes about the diabetes, to be sad sometimes about it, to make sure you've got the people around you who can hear the whole thing without trying to talk you out of something that you're feeling at the moment.
So the way that I talk about this with individuals is you can strive to be more in control, which is good, but knowing that there is no perfect control. And I think people make the mistake of, I need to be at this number, I need to be at this number, I need to be at this A1C, I need to be at this. And you need to be there. Maybe, yes, your doctor said you need to be there, but nobody has perfect control of their diabetes. That's not how this disease works. And I think accepting that idea that there is no perfect number and there is no perfect control is step one to learning how to have more control, is knowing that you won't have all the control. Mm-hmm. And then I would say, again, we talked about structures and routines. I think for diabetics, this can be really important. Planning meals as best as you can. That's really hard to do, but as best as you can. Having a routine and a structure in your day, having an exercise regimen that you do, because we all know that that's very much needed for everybody, but especially for individuals with diabetes. Practicing your relaxation, practicing those distraction strategies, meditation, yoga, whatever it is that calms your body down. Again, like Candace says, you have to know yourself. This is not whatever they call it, a one size fits all. So knowing what works for you. So I would say, knowing you're never going to be in perfect control is number one. Structure and routine and planning as much as possible. That will decrease the uncertainty. Planning for meals is really great if you can. Sometimes individuals are in situations where that's not really possible every day. Exercise regimen or a meditation regimen that includes any meditation strategy that you find helps you. And then I would say talking to people, talking to people with other individuals with diabetes is important, because those individuals, sometimes you feel like those individuals truly understand how you're feeling, as opposed to your friends maybe that don't have diabetes and can't really fully appreciate what goes into that disease. Sometimes that could be really helpful for people too. So those are some strategies.
I'm glad Tina brought that up, that to be with others who are walking in the same shoes, that get it, that feeling of, oh, this person gets it.
No, absolutely. You know, and I think, well, I mean, again, we have to acknowledge that healthcare professionals that may not have it also can be very helpful too. So, I mean, again, we do sure that, you know, again, there's a variety of people that can support you. And just to what Tina said, your diabetes may vary, and we have to acknowledge that there is no one way to address this, and also understanding what we can and cannot control. So for ladies, and I know for all of you that are on, if you've seen in the chat, Rebecca has been putting some the ADA website for some mental health resources. But what other resources might you ladies even recommend? I know we've talked a little bit about that earlier in some of our previous questions, but I wanted to kind of wrap things up for everyone, because it's going to be fresh on their mind of, you know, some marching orders of one of the things that they can do today for their diabetes and for the holidays.
Well, one thing we hadn't mentioned yet is participating with organizations like the ADA, because that is a way to feel that there's a group that cares and that you're part of in some way or another, whatever way you can, and to be with folks who understand, and to feel that you're working to help the community as a whole, to feel that sense of purpose, to know that you can participate to help others as well as they're helping you.
Yeah, I would say, you know, the ADA website for mental health resources is really helpful. So that's a great place if you haven't looked to look. Also, you can check wherever it is that you get your diabetes care. Sometimes different institutions have different support groups that are just specific to the institution. So you can also ask about that. And is there anything going on, especially during the holidays, just like support groups, things like that through your healthcare institution. I know like at the University of Chicago, we have a couple of these that go on, and you can get support that way. You can go to the Illinois Psychological Association website for mental health resources as well. Those are not going to be diabetes specific. They're going to be a lot more general. So just be mindful of that. But for more diabetes specific, I would start with the ADA and then use links there to help you sort of navigate that. And if you run into trouble, ask your endocrinologist or your primary care physician.
Or your diabetes care and education specialist.
Oh, yeah. Don't forget them.
Ladies, I want to thank you so very much for your expertise today. This has been such a lovely conversation with both of you. Thank you for your time and your efforts and everything that you do for people with diabetes. And for all of you that are on the call, thank you so very much for being here today, and have a wonderful holiday season.
Thank you, Amy, for putting it.
Thank you, everyone.
Bye now.
Okay.